Hi, and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we're going to do a bit of problem-based learning. So the character in this story is going to be a young lady of 30 to 40 years of age presenting to our clinic complaining of a little bit of hair shedding, but she's seeing overall more scalp exposure in every part of the scalp, the temples, on top of the scalp, as well as noticing that the back is a little bit thinner, and she's very concerned because this has been happening for more than 6 months now. And this provides a diagnostic conundrum. And in previous episodes, we did talk about the importance of clinching a diagnosis before we can get good outcomes. Now, in this patient, the most likely diagnosis that is running through your hair practitioner's head would be chronic telogen effluvium, or a shedding condition of moderate degree that's lasting more than 6 months. And we can differentiate that from female pattern hair loss by way of a careful history taking, looking for genetic history, as well as whether the patient has had a prolonged period of hair gradual thinning versus a sudden onset of heavy shedding or increased amount of hair fall. Further examination will also reveal a degree of anisotrichia if the patient has had female pattern hair loss. So in chronic telogen effluvium, we are looking out for hairs that are quite uniform in caliber, just that they're more sparsely placed, versus areas that have thick and thin hairs all around the same time. Now, this will be confirmed further with quantitative trichoscopy if necessary, if the diagnosis is still in doubt, and we use a system called the Tricolab Studio. And we also will order some blood tests for the patient to see whether there are any contributing factors, or if there's any origin of this chronic telogen effluvium, such as nutritional deficiencies. So now we get to the treatment part. If we find that the patient has a diffuse type of female pattern hair loss, usually hair transplant is not the answer, and we want to treat the patient according to what the best clinical guidelines are, which include things like minoxidil, androgen blocker, and some regenerative medicine techniques. However, if the patient is having chronic telogen effluvium due to, let's say, a nutritional deficiency, the approach will be first to counsel how do you get these nutrition levels up, but also in the meantime start them on some supplements, or in fact we can also include something like Trichopad or scalp boosters, as I've previously discussed, to help improve the growth rate of the hair. For the less common diagnoses such as DUPA, which is diffuse unpatterned alopecia in a lady, we would want to be able to see that almost every area of the scalp has features of anisotrichia. That's something that's quite rare and a little bit harder to treat, and we do need to manage our patients' expectations when it comes to DUPA. The other conditions would be things like FAPD, fibrosing alopecia of diffuse pattern. So that closely mimics female pattern hair loss, but on trichoscopy you can see that there's some features of scarring alopecia. In these patients, really the goal is to maintain their current state of hair, with the opportunity for a hair transplant or restorative treatments to be minimal, and we have to manage the expectations as well. The final, more esoteric diagnosis when it comes to diffuse thinning would be alopecia areata incognita. This will show some features of alopecia areata on the scalp, such as little black dots or exclamation mark hair scattered all over, and the regrowing hairs sometimes appear to be white. Now, this is very rare, and I've only come across patients twice having this condition, but this condition usually has quite a poor prognosis if not treated appropriately with JAK2 inhibitors or with some systemic steroids. As you can see, somebody who presents with the same set of symptoms can have multiple probable diagnoses. It's important that if you are plagued by these symptoms, that you seek medical opinion in order to get the best outcome. If you have any further questions regarding this topic, feel free to leave them in the comment section below. Click like and subscribe for more hair loss and hair restoration related content. I'll see you next time.